Welcome, curious minds, to another episode where we unravel the mysteries and oddities of the human body. Today, we're turning our attention to a topic that's often overlooked but holds a wealth of surprising facts: male nipples. Yeah, you heard me right. Beyond their evolutionary enigma, these little features have tales to tell, from unexpected sensitivities to potential arousing potentials. So buckle up for a journey into the world of male nipples as we unveil odd facts that might just change the way you see this often dismissed part of the human anatomy. Don't forget to hit that like button, subscribe for more intriguing insights, and let's embark on this adventure together. Number 1. A man's nips may be just as sensitive as a woman's. Sensitivity in the nipple area can vary widely among individuals, regardless of gender. Now, while the female nipple is often associated with breastfeeding and is generally more prominent in discussions about sensitivity, it's essential to recognize that men can also experience significant sensitivity in their nipple area. The nipples contain a high concentration of nerve endings, making them a potentially sensitive and erogenous zone for both men and women. As a result, some men may find nipple stimulation pleasurable and arousing. The level of sensitivity is a personal and individual experience, varying from person to person. Understanding and acknowledging the diversity of experiences with nipple sensitivity helps challenge stereotypes and promotes a more inclusive perspective on human anatomy and pleasure. It also underscores the importance of recognizing that individuals, regardless of gender, can have unique and varied responses to different forms of touch and stimulation. Number 2. A man's nipples may change over time. A man's nipples can undergo changes over time due to various factors. Hormonal fluctuations, especially during puberty or other life stages, may impact their size and shape. Weight fluctuations, whether through gain or loss, can also influence the appearance of the chest area, including the nipples. Engaging in chest-focused exercises or experiencing muscle development may contribute to changes in the pectoral muscles and, consequently, the nipple area. Health conditions such as Gynecomastia and the natural aging process can further contribute to alteration in the nipple's characteristics. Medications, lifestyle choices, and environmental factors may also play a role. Regular self-examinations are essential to monitor any changes. And if concerns arise, seeking guidance from a healthcare professional ensures a comprehensive evaluation and appropriate advice. Number 3. Males develop breast cancer. Although less common than in females, males can indeed develop breast cancer. Breast cancer in men occurs when there is an abnormal and uncontrolled growth of cells in the breast tissue. Now, while men have less breast tissue than women, they do have a small amount, and thus they are susceptible to the disease. The risk factors for male breast cancer include age, with diagnosis typically occurring in older men, a family history of breast cancer, inherited gene mutations, radiation exposure to the chest, liver disease, elevated estrogen levels, and certain genetic disorders. It's crucial for men to be aware of any changes in their breast tissue, such as lumps or nipple abnormalities, and seek prompt medical attention if any concern arises. Early detection through self-examination and regular medical checkups is key to improving outcomes in case of male breast cancer. Number 4. Evolutionary mystery of male nipples. The evolutionary mystery surrounding male nipples captivates researchers and enthusiasts alike, as these seemingly vestigial structures pose intriguing questions about the efficiency of natural selection. The paradox lies in the fact that male nipples appear to lack a direct functional role in reproduction, particularly in the context of breastfeeding. The solution to this mystery unfolds in the early stages of embryonic development, where all embryos initially follow a common template, forming structures that could potentially become either male or female. It's only later in development, under the influence of specific genetic signals, that the trajectory towards male or female traits is determined. The retention of male nipples may be a consequence of the deeply ingrained and shared genetic program governing their development. Some theories propose that the cost of eliminating male nipples does not outweigh the benefits, as a shared genetic pathway may serve other critical roles in sexual development. Thus, the evolutionary mystery of male nipples invites us to explore the intricate interplay of genetics, shared ancestry, and other mammals, and the complex forces that have shaped human evolution over time. Number 5. Inverted nipples in men. Inverted nipples in men, a condition where the nipples retract inward instead of protruding outward, can occur and are generally benign. The phenomenon may be present from birth or develop later in life due to factors like aging, hormonal changes, or scarring from surgery or trauma. The severity of inversion can vary, with some nipples easily pulled out temporarily and others more challenging to avert. In most cases, inverted nipples are painless and do not pose a health risk. While congenital inverted nipples often don't require medical attention, acquired inversion may warrant further evaluation, especially if there are sudden changes in nipple appearance. It's essential to distinguish between benign cases and those that could be associated with underlying issues, including rare instances where inversion may be a sign of breast cancer. Number 6. Milk production possibility. Although exceedingly rare, instances of milk production in men, a condition known as galactorrhea, have been documented. This phenomenon typically arises from hormonal imbalances, specifically elevated levels of prolactin, the hormone responsible for stimulating milk production in women. Various factors contribute to these imbalances, including certain medications, tumors affecting the pituitary gland, and hormonal disorders. Additionally, stress, nipple stimulation, and underlying medical conditions such as liver disease or hypothyroidism can trigger galactorrhea in men. Medical evaluation is crucial to identify the root cause, often involving blood tests and imaging studies to pinpoint hormonal irregularities or abnormalities. Number 7. Thermoregulation hypothesis. The thermoregulation hypothesis offers a compelling perspective on the evolutionary mystery surrounding male nipples. The theory states that the presence of nipples in both men and women may serve as a shared function related to temperature regulation during embryonic development. In the early stages of fetal growth, all embryos follow a similar template, developing mammary ridges that could potentially lead to the formation of nipples. The retention of male nipples, according to the hypothesis, may be an evolutionary byproduct of the shared development pathway that facilitates thermoregulation. The idea is that the presence of nipples in both genders contributes to the maintenance of optimal temperature conditions during this critical phase of embryonic development. While male nipples themselves may not play a direct role in reproduction, their retention could be attributed to the broader genetic stability and efficiency provided by the shared development process, emphasizing the intricate ways in which evolution has shaped human anatomy. The thermoregulation hypothesis adds a nuanced layer to the ongoing exploration of the purpose and persistence of male nipples throughout evolutionary history. Number 8. Cultural symbolism. The cultural symbolism of male nipples varies widely across different societies and historical contexts. In some cultures, male nipples hold little to no specific symbolism and are viewed as natural components of human anatomy. However, in other cultural frameworks, male nipples may carry symbolic significance related to notions of masculinity, modesty, or sensuality. Certain cultures embrace exposed male nipples without attaching particular meaning, while others may associate them with notions of strength, virility, or fertility. In the realm of fashion, the visibility of male nipples has been a dynamic and sometimes controversial element, challenging traditional norms and gender expectations. Number 9. Gynecomastia possibility. Gynecomastia, the enlargement of male breast tissue, presents a noteworthy possibility in the realm of male nipple health. While often benign, gynecomastia can be a source of concern for many men. Hormonal imbalance, particularly an increase in estrogen relative to testosterone, contributes to the development of this condition. Gynecomastia can manifest at various life stages, including infancy, puberty, and aging, and it may be triggered by factors such as certain medications, chronic liver disease, or obesity. Physiologically, the condition results in the proliferation of glandular breast tissue, leading to noticeably enlargement of the breast and, consequently, the nipples. Beyond its physical aspects, gynecomastia can impact psychological well-being, causing distress and self-consciousness. Number 10. Arousing potential. Male nipples, often overlooked in discussions of arousal, possesses a surprising and intriguing arousing potential for some individuals. Contrary to traditional gender norms, the nipple area in men contains a network of nerve endings that, when stimulated, can elicit pleasurable sensations. While not universally experienced, many men report heightened sensitivity and arousal when their nipples are touched, kissed, or otherwise stimulated. This erogenous potential challenges a stereotype about sexual response and underscores the diverse and individualized nature of human sexuality. The arousal capacity of male nipples highlights the importance of acknowledging and exploring the full spectrum of sensual experiences, promoting a more inclusive understanding of pleasure beyond conventional expectations. Understanding the nuanced nature of arousal in men contributes to a broader and more inclusive discourse on human sexuality and intimate connections. As that wraps up our dive into the quirky and surprising world of male nipples, who knew that these seemingly innocuous features could hold such fascinating stories? From evolutionary mysteries to potential arousing sensations, we've peeled back the layers to reveal the unexpected. If you enjoyed this exploration, don't forget to hit that like button, share with your curious friends, and subscribe for more intriguing insights. What other topics would you like us to uncover next? Drop your suggestions in the comments below, and let's keep the conversation going. Thanks for joining us on this journey into the lesser-known facts about male nipples. Until next time, stay curious, stay informed, and keep exploring the wonders of the human body.